What's happening here in Massachusetts is we have great doctors, great hospitals, very innovative healthcare sector, right alongside a very innovative tech sector. And health IT is really at the intersection of those two, and that's why we're seeing some very interesting developments there. Well, so I think from the individual's point of view, what we're trying to do is to really make sure that the increasing use of technology in healthcare does produce better outcomes, lower cost, and better quality. And what you see in various industry sectors, you see that, and in various aspects of our daily life, that more technology can be a good thing, but it isn't necessarily a good thing, and it really has to be done in a thoughtful way. So we're trying to make sure, in healthcare, for example, a very big issue from the economic development side is the cost of healthcare. We have to make sure that the cost of healthcare comes down in order to support businesses, especially small businesses, to help them grow. So technology can be used in ways that help bring the cost of healthcare down, and we have to make sure that that's what happens. So that's a very important perspective that we bring to the table, is let's make sure that increasing technology in healthcare really works to decrease the cost of healthcare. We're trying to move in Massachusetts the whole healthcare sector to the direction of focus on outcomes, low cost, high quality, and asking ourselves a question in the way we're thinking about healthcare reform: how are we paying the various providers? What kind of incentives are we providing? How are we making sure that the systems align so that the financial incentives of all the participants, including consumers, by the way, is for low cost, high quality outcomes? The goal is to have it be a better functioning market, and to the extent that we are exercising our regulatory powers in Massachusetts, it really is toward that goal. As you say, there's a lot of ways in which the healthcare market in Massachusetts right now, or anywhere in the country in the United States, doesn't work as an ideal market that you would learn about in an economics textbook. You've got people who are consuming services, but they're not paying for those services necessarily. They got someone else paying for them. You've got doctors and hospitals and other providers who are being paid fee for service, so they're not being necessarily paid for outcomes. They're being paid for procedures and process. So we're working to bring those more in line. Technology has a big part to play in that. Give a simple example, which is transparency. In other words, a lot of people feel that one way that the healthcare isn't working as a market is they just don't know the cost of things. When you go to a doctor or a hospital, you may not even, because the insurer is paying the bill, you may not even see the bill, or you may not even be aware that when you choose provider A versus provider B, that in fact the cost is 50% more or 100% more. So we're trying to introduce greater transparency into the system, and technology will really help us to do that. But putting information on the web, we can get a bigger picture of how the economy is working and how pricing is working.
Great.
When you're focused on economic development, the critical issue for us right now is the cost of healthcare. So the question is, how do these technologies that we're bringing to bear, how do they help us address cost? We talked a little bit about transparency. How can they help us improve the transparency? Another one is choice and giving consumers a sense that they do have choice. So for example, as we talk about creating electronic medical records that are portable, in many cases you may feel that even if it's your own medical record, that it is really more in the control of your doctor or of a hospital. And if you want to switch to a different provider, you may feel that it's not easy to do that because the medical records won't travel readily with you. Your medical history isn't available directly to you. So if we can change that, if we can make electronic medical records that are truly portable and can be used by different providers, and the technology allows for that, then it will also give medical consumers, the patients, a greater feeling of choice and control over how the decisions they made and which providers to choose. So that's very important to us. What are the aspects of the system that we can think about that will help cause patients to be going to the lowest cost, highest quality provider for any given outcome? And interoperability. In other words, the feeling that if I had an MRI taken by one provider, that when I go to another hospital, they're not going to order another MRI. That my MRI, ideally that my most recent MRIs are there waiting for me, or I could have them sent there. Yeah, and in particular, what are the best solutions, best practices that we're seeing that move healthcare to be more of an open market, and to create some sense that that patients can move freely between providers and look for the best cost and quality outcomes, and get more information about what the options they have are, but also really give them a freedom of choice that some people want, like their doctor and hospital, of course, but the feeling that if they want to move, they can. So it starts, I think it starts with setting the goal. In other words, that we want to start by saying that if our aspiration for the healthcare system is to have a system that is functioning to create the lowest cost, highest quality outcomes, and if part of that is to have a functioning healthcare market, that means people need to be able to go to different providers from time to time. And that means we have to set the standard at a high level of interoperability. Now, the other part of your question really was, if that's the goal, how are we going to get there? Is the best way to do that for the government, or a state government or other government, to set particular standards to do that? And I think that's one of the questions the conference will have to address. If the goal is interoperability, how do we do that? Do we have government telling various in private sector companies, here is what you have to do? Or do we just set a standard of interoperability and set it sort of as a performance standard, and then tell various companies, we're not judging what your technology is, but we're saying that whatever technology you're going to bring to bear, it has to meet a performance standard. On meaningful use, it's going to be a combination of both what the technology companies do and what the providers do. But can we set a performance standard and then say, leave it to the private actors to figure out how best to get there? How much of the technology that we're talking about needs to be interoperable in order to provide that kind of meaningful connection? So it may be that some of the information and some of the technology that we're using within a given medical setting can be standalone, and that we just need to know that there's a certain amount of that information that is being generated is readily available for others to use, and so the patient can kind of take with them wherever they go. That's another question we'll have to look at. What's exciting to us is when you look over the last 20 years and you see the way that technology has played an absolutely disruptive role, I mean that in the positive sense, but a disruptive role in so many things that we do. It's changed the way we communicate in so many other areas. And I think all of the technology folks would agree that healthcare is an area that hasn't yet experienced that disruptive change yet. And so there's going to be a lot of change, and that is going to be make some folks nervous, but it's really quite exciting. And when you think about the tremendous progress we've made in other areas that technology's brought to bear, I think most people would agree that there's that opportunity for that kind of positive change in healthcare as well, and that we haven't seen it to the degree we've seen in other places, and that's what we will see in the next 10 years or so, and that we're just on the verge of something very big, that we're going to see some fundamental changes in which people use the healthcare system, and if we do it right, the change is going to be very profoundly exciting and really make it a better place.